Neuralink had similar ambitions to us, and they had like infinite bankroll to do this. We had, over the same period of time, we raised like a fifth, a sixth of the money as Neuralink. But we still were, let's say, like uncompromising in the kind of device that we wanted to build and the kind of performance that we wanted. There were easier ways to raise money over the last 10 years as a brain computer interface company. There were a lot of gimmicky wearables that came and went. There were a lot of things that were easier to finance, and there would have been a lot of like easier paths to raise money, and we kept doing this. It was painful, but now that we're coming up on our clinical trial, now that we have human data from May, things have changed, but it was definitely a long path to get here.
Welcome to Austinpreneur, our show about the stories that made Austin, Texas a global hub for startups. The show is produced by Capital Factory and hosted by me, Nick Spiller. As a reminder, by joining Capital Factory, you can plug into the ecosystem where the stories on this show were set. Learn more about us at capitalfactory.com.
Well, let's kick it off. Welcome back to the Austinpreneur podcast. Thanks for everyone who's here in the studio at Capital Factory. Thanks to everyone who's listening out across the world, our thousands of listeners across the world. And we have a very exciting guest today. We have Matt Engel, CEO, Austin-based CEO of Paradromics, which is a brain-computer interface company. Earlier this year, announced they successfully implanted their brain-computer interface in a human being. And we're going to dive into that. He's a very smart individual, so forgive me if I look dumb next to him. But y'all, I know we got smart people in the audience, so we'll have you ask questions at the end.
I'm going to try to run out the clock so we don't get any smart questions.
We'll see. I only have like 2 or 3 things to dive into, but no, we're going to get to some questions. That's often the best part. But Matt studied at Carnegie Mellon, Stanford, one other school I didn't know. What was the other?
I got my PhD from the University of Heidelberg.
Where's that?
That's in Germany, in Heidelberg, Germany.
How did you end up in Heidelberg, Germany?
My advisor found me. He was doing a sabbatical at Carnegie Mellon. He convinced me to help him start his lab, which turns out, like, if you're starting a PhD and someone says, help me start a lab, like, that's a lot of work.
Right.
Yeah. So don't do that.
One pro tip.
Yeah, but it was great, actually. And so then I came from Germany, back to the U.S., did my postdoc at Stanford in material science and engineering.
Awesome. Well, before we get too far into it, let's welcome Matt to the Austinpreneur podcast. All right. Well, let's start with the basics. For those who aren't familiar with the category, what is a brain-computer interface?
So brain-computer interface is a modem for the brain. It's a device that sits in the brain, at least the kind that we make. If you put it in the brain, you get much more data. So there are other kinds of ways to record from the brain. You can be on the outside of the skull, you can be all kinds of places, maybe on the elbow. But if you're not inside of the brain recording from individual neurons, you don't have the highest resolution. So everything I'm going to be talking about right now are the kind of high resolution, high bandwidth BCIs that sit in the brain and talk to individual neurons. It's the kind that Paradromics makes. It's the kind that our neighbors in Austin, Neuralink, make.
Yep.
What it does is it reads out information from the brain and it makes it accessible to a computer. Or it takes information from a digital system like a camera or a computer or a microphone and it makes it accessible to the brain.
Fascinating. And so you're implanting a device, a chip, basically, that you've developed in someone's brain. You're reading out brain data. I mean, what kind of data do you get out of a brain? Like, tell us more in detail, like what you're recording, what you're reading.
So the first people who get Paradromics brain implants in clinical trials, they're going to get a device in their motor cortex. They're people who are paralyzed, like the physicist Stephen Hawking, people who've lost the ability to speak, can't move their hands. Essentially, the signals from the brain don't make it to their body anymore. But they're still in their brain. So if you take a device like our device and you put it in the motor cortex, then you can allow for them to attempt to move or attempt to speak and know what they're trying to do and then make that an action on a computer. So they can speak through a computer again, they can control a computer mouse, they can type, they can do all the kinds of things on the computer that a person who is able-bodied could do.
Fascinating. And so this is starting with these disabled applications. Is it like where does it go from there beyond what we see people using it for initially, you just described?
Well, I mean, think of everything, your whole world is information. So everything that enters your brain from touch, from seeing, or for hearing, everything that enters your brain is information. And a brain-computer interface can provide information to the brain, which means that a brain-computer interface, in theory, can provide a completely immersive experience from the brain that's indistinguishable from everyday life and can augment everyday life in a way that, like, while we're having this conversation right now, let's think of all the things like my voice right now. Often, I'll be honest with you, my voice when I call like AAA or something like that, they're like, "Oh, excuse me, ma'am, would you mind waiting?" And I have like a really high voice.
How rude.
But maybe you're like, man, this voice that Matt has is super annoying to me.
I would have never guessed that.
But if we were like on Zoom and you're willing to tolerate a little bit of latency, there are voice changers. So you could be like, I kind of would rather him be Morgan Freeman. And now, like, consider the fact that like a BCI that's connected to your auditory system could do the same thing and could do it with a latency that could probably keep up with real time. And so that's just like a weird changing thing. The other thing would be like facial recognition. Some people are not very good at recognizing faces. The ultimate AR/VR system would help you with that. And there's already kind of creepy glasses that people wear and try to do that, but it could just be built into your visual system.
So it almost like enriches what you're already thinking about.
Absolutely.
And can allow you to go do kind of what your brain already does, but just do it better in an improved fashion.
Yeah, and the cool thing is that all of the medical devices that we're building to restore vision for people who can't see become the ultimate AR/VR experience for someone who can't see. The medical device that we would build for someone who's deaf becomes that cool sort of voice augmentation, automated translation system that could be in line for a person who can hear to hear. Even things like people who are paralyzed will probably want to be able to move humanoid robotics so that they can like do their own chores in their house. But then it becomes like, well, why couldn't I do that too? Or why do I have to be limited to the humanoid robotic in my house? Why couldn't I also have one at my kid's house so that when my grandkids need like help, I can like, I have 3 kids. Like, how am I going to help all of my 3 kids when they're all having kids at the same time? Well, I could have 3 different robots in 3 different homes and I could control them over the internet. Like, and these are things that, we're not building those things right now. We're not building those applications right now, but the tech stack that we're building to enable paralyzed people better autonomy in their homes is literally the exact tech stack that you would build to do the things that I just said.
Is most of that is all through the motor cortex too, or what other parts of the brain
So
do you see?
The first applications in BCI are going to be the places we've studied the best.
Okay.
Sensory areas and motor areas.
Okay.
The reason why they're so well studied is because most of the stuff where can I say fuck around and find out?
Fuck yeah, you can. Fuck yeah, you can.
Okay, good. So like most of basic neuroscience is fuck around and find out. Yeah. You can't do that in a person. It's not ethical. So you have to do that kind of work in animals. But animals don't speak. They don't like write books. They don't have like very complex emotions that humans do, or at least they can't communicate it verbally. So you can't really query those systems as easily in animals. What we can do in animals is you can show them a picture and see what happens in the visual cortex. You can play a sound and see what happens in the auditory system. You can watch what it does and see what happened in the motor system beforehand. So there's great animal science that's been able to describe those systems and translates really well to humans. Now they're like the deeper things like mood, emotion, cognition. Because we haven't been able to do the same kinds of experiments in animals that in those systems, we don't know as much about those areas, but we're learning a lot.
Right.
And we're learning in human clinical trials. There's one of my like BCI heroes, Mariam Shineki, is at USC. And like her work she was a control theorist that came into BCI, which is not as scary as it sounds. But she worked on like a closed loop anesthesia machine. And then she got her own lab, and then she started working on reading out mood. And how do you get access to mood data? Well, there are patients with ECOG electrodes on the surface of their brain that are being monitored for epilepsy. But they're going to be there for 30 days, so you can ask them really interesting questions and they get that kind of data. So we know that mood is encoded in the brain and you can read it out. So we're starting to get at all these interesting things.
Right. Interesting. So you can see someone using a BCI to counteract the feelings of depression or other.
For sure.
In theory, we're like not have to take pharmaceuticals or drugs anymore.
Or it could make taking those pharmaceuticals much easier and much less invasive.
Yeah.
Okay, like, so I always love to make the analogy to the continuous glucose monitor. Like, glucose monitoring doesn't fix diabetes, right? It's not a cure or therapy for diabetes, but it completely revolutionized diabetes care. When you could get glucose measurements at home and prick your finger, suddenly, like, that brings back some control into your life. As soon as you got a continuous monitor, then you know in real time when your glucose is dipping, you can make real-time adjustments.
And analyze the patterns and tie it to everything else you're doing.
Yeah, and it became so effective that even people who are just bio-optimizers, want to do it just for working out, monitoring the blood sugar.
Right, and it could tie into my Whoop and my app that I'm using to track everything else, and it's just one more.
Imagine if you had that in your brain, and imagine if it could be like, hey, you aren't getting enough sleep. You're fixating on that issue with your mom again. So, and it could be.
Thank you for the reminder.
And by the way, like, take one large red pill and one small blue pill before you go to bed. And that thing we talked about won't happen tomorrow.
Very precise. You talk about data rate, and I know that's a big focus of the especially the invasive implanted BCIs. Why is that important? Let's dive into that and help understand what that really means.
So the currency of information in the brain is individual neurons firing action potentials.
Yeah.
And so the more neurons you can talk to and the ability to resolve these single neuron signals means that you can get the most out. The more neurons you talk to, the more data you have. And what we have is basically like an early internet situation where there are things that we can do right now with the number of electrodes you could have in clinical trials. With older devices, you can control a cursor. There are competitive platforms to Paradromics that are basically buttons that you can press like once per second. And so, like, those platforms tap out in what they can do. Yeah. And now, like, Neuralink system, let's say, is and benchmarked the highest information transfer rate that they've ever reported is 10 bits per second. So everything you've seen in the videos is at 10 bits per second. We've separately benchmarked our systems in sheep in other sort of tasks, which has a bunch of asterisks, and we're going to publish something later this month about this. But we're far above 100 bits per second, somewhere between 150 and 200 bits per second right now.
A lot of bits.
And so, like, that is enough. We've shown that the hardware has enough headway to do more advanced things. What does more advanced mean? Like, our conversation that we're having right now, if we took a transcript and we played the transcript out at the rate that we're talking, it's about 40 bits per second. If you want to layer on emotion and sort of a little bit of texture to the conversation, it's more. It's a weird thing to say, but we have some interns playing like Nintendo through a sheep's brain. It'll make more sense later when we come out with.
What's the user experience on that?
So we can connect. All of our sheep demos that we do are in sheep auditory cortex, and we have the ability to play complex sound sequences to sheep and then read out from their auditory cortex what they heard. And so we can reconstruct the sound that we played on the other side. And then that's actually how we figure out how much information we transferred, like how good of a job did we do. But effectively what we've built is just a data pipe, and you can push arbitrary data through a sheep's brain. And so at any rate, if you want to play Mario Kart, or if you want to play, I think Roblox is one of the things they were playing. They're
popular games.
They're about I think so. It was operating around 100 bits per second in this sort of model where they're pushing data into a sheep's brain. And so that's...
So you've built like a cheap application layer on top of Roblox.
What I'm saying is that you can think about applications, and you can think about how much data do I need, to control various things and do various things. And then you can start to look at it in the context of your brain implants and say, like, on first principles, does our brain implant support that application? And then as each brain implant gets better and better, then the application space of what you can do gets bigger and bigger, and it becomes like the early internet, where you have what the internet did in the late 80s, early 90s, what the internet did in the 2000s, what it did in the 2010s. And when you track it, you're like, oh, wow, that was a really cool pivot that Netflix made in 2010 to stream real-time video. But it wasn't because it was a genius idea. It was just that enough people had enough data at that time to make that application work.
Right.
And so the history of the internet is a history of expanding internet infrastructure and hardware.
Bandwidth. So we're in the dial-up days, and we're going to progress into gigabit and beyond.
Yes.
Is there a theoretical maximum of the data rate you can build into?
I think it depends on the area that you're going into.
How big your brain is?
Yes.
I got a big
Maybe it's
head,
different
so-
for each of us.
Yeah. Do you have a sense of like how fast this could get in our lifetime?
I mean, the space of human action is actually like weirdly small. So if you think about like the number of things that you could do right now, or I could do right now, it's probably like tens of bits per second. Like there aren't that many things that we can do, unique individual things that we can do. So in some sense, like the output is a little bit like, is actually remarkably low bandwidth. But in order to figure that out, we have to tap into certain brain areas. There's no like single consciousness center that's making all the decisions. You have to read from a bunch of different areas and then infer a decision. And so you might be a little bit in the auditory area, a little bit in the visual area, a little bit in some other area. So, but yeah, like, I mean, I would say like, I don't see any reason why we couldn't increase the data rate of BCIs by 10-fold in the next coming years and 100-fold without making huge architectural changes to the way that I would say like the two leading BCI companies from a data perspective, Paradromics and Neuralink, have been operating.
Yeah. And there's this idea of extending yourself, and like I could buy some humanoid robots and connect to these robots in other locations and command them through the brain computer interface as well.
Once you have the brain computer interface,
That'd
a
be
lot
so
of that
cool.
like sci-fi stuff is just application layer stuff.
It's easy.
Yeah.
So how long are we thinking till this is something that's beyond early medical uses and more just everyday life?
I mean, it's more of a society question than a technology question. Right. I mean, you'll see in the next 5 years, BCIs are going to be in clinical trials all over the place doing crazy stuff. The first ones are going to be coming out in the first markets. And then over the 10, 20-year horizon, it's just going to be tick, 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 seeing new things that brain-computer interfaces are doing for people. And at that point, it's more of a question of how do we want to regulate it if someone wants to get something without a clear medical indication, and who wants to get one?
I'm interested.
Okay.
You were there. Remember, we did the Open BCI demo at Health Supernova. That was that was such a profound instance. I find myself in a couple of these like very profound instances in this job where there's another. It's called Open BCI, and it actually goes on top of your head. And I was on stage in front of 400 people, and they demoed this, and they read my brain data out on the screen in front of 300 people.
I tried to get them to do like a lie detecting thing. I thought that'd be really fun.
Right.
But yeah, I have, and I think it's another Capital Factory portfolio company, Neurable.
Yep.
I have a pair of their headphones. It sits just over your ear and records signals from your brain in the area, from cortical areas, but it's lower resolution. It kind of like records the roar of the crowd as a lot of neurons are doing things a highly coordinated way. But even from that distance, you can see things like whether I'm task switching as I'm working, how focused I am.
There's an interesting benefit to the feedback loop you get with those devices, just really getting the data and knowing your numbers. I mean, I have the Whoop that I've been using, and just things that you almost kind of know already, but by seeing it and tracking it, you're able to manage to it. Especially, I think people that grew up with technology, with smartphones, it makes total sense. So yeah, the Neurable headphones, which you can buy right now online, it will actually tell you how you're focusing and some other insights for people that are working long periods of time and other things like studying, etc.
But essentially, yeah, as the technology to record out from the brain, at scale, at high bandwidth becomes more common and more people have it, then it's like that window and the things that you can infer become much wider, and the amount of time it takes to do it becomes much shorter, so that you can even think of, there are applications like in Parkinson's for people with essential tremor. You can get a deep brain stimulator that can really help with tremor. But right now there's not a great feedback mechanism for controlling that, but a BCI would be awesome at that.
Yeah. Amazing. I'm going to ask one more question, then we'll turn it over to y'all for a few. But just as an entrepreneur, you've had, I'm sure, quite a journey. Talk us through one of the big challenges you've had to overcome as a company and as a founder. See what lessons we can glean from that.
I mean, Paradromics, I don't know, for better or worse, chose to play this game on hard mode. So
I don't know if there's an easy mode.
We were really focused on building the right system. And what we defined as right system was high data rate, high longevity. And I like to tell people this sometimes, although most people may know this already, I'm not a billionaire. So Neuralink had similar ambitions to us, and they had like infinite bankroll to do this. We had, over the same period of time, we raised like a fifth, a sixth of the money as Neuralink. But we still were, let's say, like uncompromising in the kind of device that we wanted to build and the kind of performance that we wanted. There were easier ways to raise money over the last 10 years to bring computer interface company. There were a lot of gimmicky wearables that came and went.
Sure.
There were like pseudo semi-invasive approaches that were really investor friendly, but like essentially were a bad trade-off between safety and data. And like there were a lot of things that were easier to finance, and there would have been a lot of like easier paths to raise money, and we kept doing this. And in BCI, the premium is really like on human data, and we took a long time to get to humans, and it was like it was painful. But now that we're coming up on our clinical trial, now that we have human data from May, things have changed, but it was definitely a long path to get here. Like ultimately, I think we made the right decisions, and the product that we're building is objectively like the best in the field, but it's hard to like keep your head down when there's all the noise kind of blowing up around you.
It's a tale as old as time. There's a lot of different things to go after, and one of the hardest things is just persevering at the one focus, the North Star, and not straying. And the perseverance is the big difference maker with a lot of those who win and a lot of those who don't. Well, it feels like the space is heating up. Obviously, Neuralink, OpenAI put a couple $100 million into another competitor, and Capital Factory, and I think you've raised some money lately. We've invested millions of dollars into Paradromics, and we're super excited.
You guys have been awesome partners, by the way.
Thank you. So that's what people say about you when you invest millions of dollars. If you're ever wondering if you want people to say nice things, that's one approach.
It's that easy. Just give me millions of dollars.
Right. No, it's been great. How did you first connect with Capital Factory, by the way?
I don't know. I think actually there were a lot of independent connection points because for people who don't know Capital Factory well, it's like a one-stop shop for connecting with the Austin startup ecosystem. And it was that when I arrived here in 2018, 2019, but it was interesting, like still mostly software focused, like really early stage. And like, I was kind of like the weirdo, hanging out with you guys. I was pretty far outside the norm, but since then, like they've, with Healthcare Supernova, like Fed Supernova, that's been very healthcare focused, very government focused, very like space focused. Like 2 of your portfolio companies have landed on the moon. Would you have guessed that?
No, I would not have.
It's pretty intense.
It's very hard to comprehend. I don't have enough time to reflect on it all, but I think it's just really shifting the focus towards building and investing in technology that matters.
But I think that's what Austin is like particularly well situated for, is deep tech, building the stuff that matters.
Yeah, Austin's position, if we want it to be the leader of technology, of politics, of culture for the whole world, and I think it's where we have the platform now. It's just what do we go do with it? Build some BCIs.
Yeah.
First thing. So humanoid.
It's actually the BCI capital of the world right now.
Right.
I mean, think about it. Like, who are the 2 top BCI companies? Like the companies building high data rate systems that are going to move the ball forward. They're in East and West Austin.
Undisputed BCI capital. Hell yeah. Who has a question? All right, we got a few. We got a mic coming around. Lyndon's got a mic. Let's start up front with Mr. Anwar Beck.
Man, this was fascinating, Matt. Thank you so much. 2 questions. I'm getting greedy here. First, is the movie Lucy full of shit, or do we only use less than 10% of our brain? I want to ask a scientist that studies this stuff. Second, 20 years ago, before the wearables, I always thought, like, ultimately we're going to have hardware that's going to, like, track all my medical stats, weight, anything that's possible, and send data to my doctor, and the AI is going to analyze and then proactively tell me, hey, we're seeing some abnormalities. What you just told me is you're taking that to like another stratosphere. Is this like, if I've got a brain chip that can measure atom level things changing in my body, is this like the cure to cancer? Like, because you can catch things, I'm assuming, like fucking way before.
Okay, so
It's a little bit about like a window into your soul.
yeah. So the Lucy thing, like physiologically, we all use 100% of our brain. But like in terms of like human potential, yeah, well, probably most people are like, they're lucky if they hit 10. But it isn't the case that we have this like weird untapped like born identity capacity that could like, if we get like hit in the head, suddenly we use like 100%. That's not a thing.
It's just more people aren't applying themselves, or how is that even measured?
It's bullshit. Like, it's just bullshit. But I mean, I want to be aspirational.
That was his question. That was his question. You got an
physiologist
answer.
standpoint, it's bullshit.
Confirmed.
Yeah, okay, so the next thing was about like, yeah, okay, we're really smart. We can build chips that read out like neural states and do advanced things, but like part of the reason why that future that you just described doesn't exist yet is hospital bureaucracy, and we're not that smart. We can't fix hospital bureaucracy and healthcare bureaucracy. Like there's still really big structural issues that need to get ironed out, and it's going to take everybody working on it. But the question of what, that's probably why, that's why those things don't exist for you right now, which they technically absolutely could. But if you're talking about like, hey, what would it mean to have a brain-computer interface and what would that open up? Yeah, I mean, the thing that's cool about brain-computer interfaces is they have a privileged look into a data source that none of those other wearable devices or none of those other things have. And you know, now that we're moving into the AI era, I think everyone's realizing that having privileged access to those kind of proprietary data sources, particularly when they correlate with really important things like human happiness and welfare, that's gold. And so there's increasing understanding, there's real-time as we speak, a kind of reframing of BCI from just like a prosthetics application that moves data from one place to another to access to brain data and the ability to build foundational models that couldn't be built any other way.
It's wild to think how much we infer just from what we like on Facebook versus like what you can infer if you can read brain data raw with the BCI.
Yeah, I mean, it's really exciting. And what I think is very, very cool is that the first healthcare use cases, even a use case like speech, you know, there are a lot of areas involved in speech. Like speech is a really complex task that crosses a lot of boundaries and through different brain areas, through different cognitive processes. There are going to be biomarkers that come out of the earliest trials for BCI that are informative for other things. And having access to this data, we'll be able to build models and build better understanding that let us launch in kind of new cures. And then one day there'll be this tipping point where it's not just talking about cures, but also talking about basically apps.
Right. Pushes the envelope on the research itself broadly just by trying to develop the technology. Yeah. Incredible. Question?
Well, thank you so much, Matt. I found very interesting, like the topic so far. I had a couple of questions, but you know, I'll let you pick perhaps one that you like, depending on the time. One we discussed a little bit earlier about example like diabetic, implants that we find. So with those BCIs, are you also able to have access to the interstitial fluid? I think, and so usually with those you can track healing and with like injuries. So I was curious if that was something that was kind of in your scope, perhaps.
We're more of an electrical company than a chemical company. So you're absolutely right. Like putting sensors in the brain and looking at the cerebral spinal fluid, picking out markers. There's a ton of cool stuff that you can pick up. But we're more focused on brain activity and knowing what the brain is like in motion when it's processing data. And so that's kind of our real specialty, is putting in lots of electrodes and getting those recordings and then making inferences about what's happening in the brain.
Yeah, well, that's what I was thinking. I was just kind of curious, perhaps if that was like kind of in the line. And also we kind of flirted around that subject about performance in a way of like the brain. And so we also talked about AI, so that's why I'm connecting those two. So I was wondering, since with AI we see a lot of kind of hallucination within AI, so that's where I'm coming from. I was wondering, is it some of your concerns? Is it something like you're kind of exploring, perhaps? I'm going to reframe my question if you need me to.
No, yeah, I mean, AI is a tool, and when you're integrating a tool into something as intimate as a brain-computer interface that might be speaking on someone's behalf or controlling a robotic arm, you need to understand the limits of the tool, and you need to have safeguards for the tool. And so, if you have someone who's using a brain-computer interface to communicate with their family, and it's running through a language model, you have to have some hard constraints on that and say, we're using the language model to correct obvious errors, but don't paraphrase or don't hallucinate. If using it to control, a robotic arm, if there need to be hard boundaries for like what it can do. You don't want someone to like punch through a wall or do something crazy.
Thank you so much, Matt. And as a fellow clinician, I'm kind of geeking out on all this stuff too. I have a series of questions. I guess we'll take it one at a time. So how unique or how common are the electrical patterns for specific functions across all the brains? Like, for example, we know on a macro level, this areas of the brains that control certain functions, but on a very detailed electrical kind of diagrammatic way, how unique is speech for all of us individually?
Yeah, I think you basically framed it correctly in the question. We know at a macro level which areas of the brain contain information about which different things. We know at a signal processing level how in a given area neurons coordinate to encode information, but we don't know a priori when we drop a microelectrode array into an area, which neurons we'll be recording from. And so there's a training process, there's a decoding process that helps essentially map which neurons are doing what and how does that connect to the application.
Very cool. And then hackability, for example, anecdotally or whether in fact, back in the day I read a story where somebody had a pacemaker and in the apartment next door, some kid was playing on the Xbox. The controller frequency or the hertz or whatever was the same as the pacemaker. So as the guy was frantically pushing his controller buttons, the other guy was having a heart attack. So like hackability of the device.
I really can't speak to the design decision that led to what you just described. I don't know. I can say that, we have a philosophy of having what we call like upstream and downstream software. So, there's an upstream software that's embedded in the device and the software that talks to that embedded software. And those can reset registers and do things that are meaningful that could impact, patient safety or like efficacy outcomes. And then there's downstream software that's really just like an application layer that we run. And so like, I think one good practice in designing systems like this is to have certain systems that are really locked down, like better than what you just described, and where we've kind of walked through every eventuality and we know that you can't F it up. And then have a lot of downstream flexibility where we know that the downstream software actually can't do any damage because it doesn't have the ability to. And so then you're more a sandbox environment. And so I think thinking through things, compartmentalizing and being maybe more clever at the beginning is helpful.
Yeah, good question.
Why a pacemaker would ever?
I have no idea.
When?
Hey Matt, thanks for coming in and chatting with us. I was curious, so today you're doing a lot of the reading coming out of the brain. At what point in the future and or how far out until you can transmit information into the brain?
So the kinds of electrodes we're using could today transmit information into the brain. And so we did some work for the Department of Defense, like early on in our journey, where we built very similar electrode arrays for stimulating. I think, at least on our roadmap, most of the near-term applications are going to be recording, and the sort of stimulation applications are going to be a little bit farther away, just for more practical kind of go-to-market reasons. They're kind of not interesting for the podcast right now. But in theory, like, those technologies already exist. There's a group at the University of Pittsburgh, Jen Collinger and Robert Gahn, that have been doing closed-loop recording and stimulation using sort of older brain implants where they can have a robotic arm that both moves and touches things and gets like haptic feedback that can be experienced by the BCI user. So that work is really important and happening and like foundational and exists. I think that the market applications of microstimulation in, for instance, touch and vision are a little bit further out.
Yeah, Matt, thank you for the talk. I had a question regarding, you mentioned when death rate, like the number of neurons matters a lot. I'm curious, are all neurons like created equal? Like, are more neurons, for example, signal more important than others?
It depends on the exact task. So I'll take, the sheep that we're recording from right now and doing all kinds of fun things with. You drop an array into the brain, and neurons in the primary auditory cortex where we're recording, they primarily listen for tones. Like, so there's one that might respond to like a high note, another one a low note. And so if you're trying to play tones to a sheep, you need to have electrodes that are near the neurons that care about those tones. So sometimes the answer is, like for any given task, different neurons will be contributing to it or not contributing to it. The same is true in motor, by the way. You need to make sure that you're near the neurons that are driving the motor behaviors you want. But in general, from like more of a broad answer, neurons are pretty uncorrelated in their responses. If you put any like random two neurons in the brain, they're mostly just doing their own thing. And so for the most part, if you're thinking about like the headroom of a device, adding neurons that you record from adds information in a pretty simple way.
Yeah, I think Nick touched on this, but in terms of like total bandwidth, but also the density of the area that you can have all those electrodes in. Do you think you're gonna ever get to a point where this technology can actually like repair nerve damage, be able to like transfer a signal out and then back to the part of the spine?
There are already examples right now. There's a company based out of Europe called Onward, and they have a spinal cord stimulator. And they're pairing right now with relatively rudimentary BCI, but they can take signals from the brain, kind of skip over damaged spine and stimulate the spine at a lower point and help restore walking for people with partial spinal cord injuries. So yeah, that exists. And as the BCIs get a lot better, the ability to control those devices will also get a lot better.
I have a funny question that is a bit ridiculous. I was thinking, what if, are you perhaps thinking of making a version that's a bit more affordable, example, for people who own pets, for example, to ease the social acceptability of the project? If they see it with their pets and they have a good interaction with it, do you feel like that's something
like kind of the loyal model for BCI?
Example, you want to talk to your cat. I lost my cat, so just.
It's funny that you asked that. I had one of my most interesting investor conversations is I was talking with a family office from China, and the principal sort of was there, and there were like a bunch of translators around, and she's just listening. I talked for like an hour. I really went into details about like why intracortical is better than surface recording, like super deep stuff. And I thought like at the end I was like, I really fucking nailed that. That was good. That was really good. That was probably the best pitch I have. And then like at the end, she speaks through a translator and says, "Could I use this technology to talk to my dog?"
And it's a profound idea, really. I mean,
and I was like, maybe. She's like, we would like to do a joint venture. So someone beat you to that.
It's good. I think that could work. I mean, I would talk to my dog.
I was still an early entrepreneur. Here's the problem. I was still in that phase where I was a scientist just coming out of my postdoc. So I said, I don't know. I don't think so. But
Now you're like-
now I would have been like, oh, absolutely.
Right.
Yeah, but it's
Sign right here.
but it's gonna
Here's
be-
the wire info.
it's going to be expensive.
Yeah, it's gonna millions. So, all right, maybe one or two more. I'm not sure where we're at on time. Let's.
I have a question. Hey, it's a privilege to meet you, and I hear you talk. I hope the startup goes, way beyond.
It's going to.
How can we missed? No. So the question is, you talked about the data rate and the bandwidth. So do you think, like most people, and we were talking about the same thing. Most people would fear a surgery, right? That's going to be forever. Do you think there's a future that would have a wearable device? It could be a helmet, it could be a VR headset, it could be even, I'm imagining Black Mirror episode and they put like this thing and everything, you get into that virtual reality or augmented reality. Do you think that future is possible?
It depends on the application. I mean, there's some places where if you want to wear, HoloLens type thing or the Apple VR thing on your face, and that's a great experience. It doesn't involve surgery. That's a good solution for your problem. But I don't think there'll ever be like a headband that you wear that talks to your visual cortex through like electrical signals that are wireless. There won't ever be, an EEG system or like some kind of clever helmet that does what Paradromics and Neuralink are doing. The physics just don't support that kind of thing. But for instance, there are already great EEG applications right now, like the Neurable headset and kind of focus applications. So I think it's just being realistic about like matching the like British say horses to courses. And so, yeah, that would be my perspective. The other thing I would push back on a little bit is, yes, for like, if you're thinking about what you might use a BCI for right now, which is like, I want to talk to my Apple Watch, brain surgery seems pretty invasive. But for people who have Parkinson's or essential tremor, and their tremor gets to be so bad that they just can't feed themselves anymore, they can't use a spoon, the decision is relatively easy to undergo brain surgery to get a deep brain stimulator. If you have intractable epilepsy, and you're suffering from daily seizures, and someone comes to you and says, we can give you a neuropiece device, or even we can do surgery to remove the piece of brain that's causing the seizure, that's an easy button. Like, people do that when the condition's impinging on their daily life. And I see the next 10 years, probably even 20 years, as being people coming to the neurosurgery clinic because they have something that's really impinging on their daily life. I can't get out of bed in the morning. I'm depressed. I don't know how to fix it. And they're willing to undergo that surgery. And then when you have 100,000, 1 million people who have devices for health conditions, then suddenly it becomes a lot easier, and that calculus that we might make about getting a brain implant is totally different.
Incredible. Everyone, join me in thanking Matt for coming on the show. Excellent.
Oh,
That's
thanks
great.
a lot.
Thank you. Thank you. Great stuff.
Thanks for listening to this episode of Austinpreneur. Don't forget to check out capitalfactory.com to learn more about us and join our community. If you have thoughts about the show or ideas on how we can work together, reach out to me directly via email, nickspiller@capitalfactory.com. Shout out to the Capital Factory Dream Team for making this podcast possible, and special thanks to Aaron Handworker, who masterfully recorded and edited the show. Come back next week for a whole new episode.